So, good morning, Akram.
Good morning. Hi, how are you?
I'm fine.
So, welcome to the All Pulp No Fiction podcast and welcome to our GC area. This is my first time in the IDS. How about you? Is it?
Yeah, it's also actually my first time and participating in some demos and some lectures.
I see.
So, it's also a special
you
time.
visited before? Because this time you're lecturing, right?
No. I haven't visited.
Oh, you haven't visited before?
This is the first time for me as well.
First time as a visitor and a lecturer. Nice. That's the way to go, I guess.
Due to COVID, we didn't have the time to, it
Yeah.
wasn't so easy. And actually, I didn't want to travel a lot. COVID was a period that changed a lot in dentistry and also in our lives. But I think we're back on track after 5 years.
Yeah.
And we can be back in Cologne and be in this amazing
I
event.
haven't been here before, but it looks like this is going full throttle.
Yeah.
I don't know how was it before, but this looks
From what I
going all
know,
out.
in 2021, it was not so big.
But that
It
was during
exactly
COVID, right?
But
Yeah.
in 19, I don't remember the dates, it was full as well. So
Yeah.
I think we're on the first day, but I see a lot of people
Already, yeah.
and a lot of new stuff coming on. Huh?
Yeah. Was there anything that you're especially interested in, or something that you want to check out in this IDS?
In general, due to my field, which is restorative and prosthetic dentistry, I work a lot with digital. My PhD actually is in digital dentistry and digital accuracy of 3D scanners, and my master as well. So also this field, I want to seek for new technologies and new stuff. But also it's really nice to be with people that we know and we have a collaboration like with GC.
Okay.
So it's a pleasure to be here for many, many reasons.
Well, thank you very much, and we were very happy to have you already. You talked about materials and digital dentistry. How often do you use digital dentistry in your clinic? Like, is this basically a daily practice for
How
you?
often I use digital dentistry?
Yeah, is it the workflow? Is it completely digital for you?
Yeah, among the years we changed a lot. So back in 2013, I was doing my master in restorative dentistry. And actually back then, there was the first Trios came to Greece in Athens, where I'm from. So in the university, I was really eager to test it because no one dentist had used Trios 3 up to the time. So we started doing cases back in 2013. But imagine the software was different, everything was different.
Yeah.
In 2015-16, we started being back on the game on digital dentistry through the university first. And in 2018, I think, we already got a scanner in the clinic. So we use a lot of scanners due to the PhD and my master thesis back then that was in accuracy. So now I see that after the last 5-6 years, we're in a region that all the scanners are good.
I see.
We can say that most of the scanners can work good in quadrant dentistry, but not in full mouth rehabilitation. Still there, we have some missing points.
I see. And regarding, GC, we are a material company, and I attended your lecture before, like you talked about the different materials that you use. For you, what's the workflow or like the thought process about material selection?
It always has to do with what we say case selection and has to do with the patients. I believe that the dentist of 2025 needs to know all the techniques from direct composites to indirect restorations. Even this has to do with implants or crowns, because if you want to do restorative whenever you want and in whatever country you live in, you need to know all the techniques. And nowadays, it's really nice to have companies like GC and other big companies that can produce materials and achieve optimal results by not being afraid of what will happen. The variety of materials beginning from direct composites. I mean, GC has more than 5 systems for direct composites.
Yeah.
And all of them are successful. That's why they continue.
It was interesting for me, like your lecture included a lot of layering, like you talked about layering.
Yes.
And you said also in the lectures that sometimes you use different systems in the same restoration.
Yes.
How do you? Why do you do that?
I do believe that I really admire dentists who can do mix and match, as we say. So if you take all the composites that exist on the market, you will see that no system can get 100% of the cases. Depending on the origin of the company or the composition or the filaments, you will see that each composite has some characteristics. Other are more red, other are more yellow, other are more translucent. So for many years I have used all the most interesting systems exist due to my field of restorative dentistry and all this stuff. And I always saw the possibilities of using different systems because one system can give you more translucency and one can give you more higher value. So the interesting thing is that no company has given what GC has, meaning that by having, like for me, the two best systems I use mostly is Accord and Essentia.
Accord, like GNL Accord.
Yeah, GNL Accord
Yeah.
and Essentia.
I see.
So by using enamels from Essentia, some modifiers from Essentia, and sometimes the dark dentin from Essentia or the light dentin from Essentia, together with the Accord that is a way more simple, a very simple system that each dentist can use, you can have optimal results and combine the possibilities of these two systems.
I see.
In the older days, I had at least 2 or 3 companies to do that. And it's difficult for the office to be able to order, take a Crown and order Accord.
Yeah.
Take Nicholas and order I don't know what.
Yeah. I think many dentists tend to use one system. I think, and
Yes.
your idea right now is to use different restorations.
Again,
Yeah.
I believe that it's important for the dentist to understand what is his needs, what he wants to offer to the patient, because there is no wrong and right in dentistry. There is something that is certified or not.
Yeah.
But we can do dentistry with monolayers. That's why Accord can work from simple to more. If you use also enamels from Accord, it can be a more specified system that can be used for multiple purposes. So for sure, one dentist can use one system. And it's way more easy if you have a clinic to order 10, A2 and 10 A3
Exactly.
for this week, because we have a clinic and we have like doing composites like this. But also you can give the patient the ability and the dentist by having 2 more composites to give better results.
So something that is not maybe so common. Some dentists would be like, okay, GNL costs this much, Accord costs this much, so I'll use it for these cases. Essentia costs more or whatever. Like, think about it as pricing based. You don't probably
Yes,
this approach is not
it's always in Greece, at least there is always this discussion.
right.
Like how much does this cost,
Yeah.
or is it it's €5 more expensive, I will not buy it.
Oh, no.
No. But we talk about these numbers, 5 and 10 euros about the composite, it's not more. And we know, all the dentists inside, that we can have a lot of restorations from one single syringe.
Yeah.
So if you take off the numbers per restoration would be, I heard Anne yesterday talking about 5 to 6 euros.
Yeah, it's the price difference
yeah.
doesn't really go.
But from my at least statistics, I guess it's less than 5 euros per unit, because the whole composite is just 10 euros more expensive. So I'm sure that it's not so much more expensive to use it. And the thing is that we have to go out of our small little box that we have in our head. Excellence is something you can achieve, and it can be achieved by anyone, and you only need to train, to take maybe a lecture.
And don't limit yourself to certain material
Yes,
to only use
yes.
this material. That
Sometimes we think we cannot achieve something because we haven't even tried. And it's all about trying, and you will get better. You see all the big names and you think, wow, how do they do this? It's just giving time. And you don't always need to give time, because on the other hand, we just do teeth. So we can have like a restoration, a really quick, but it should be correct with all the basis of knowledge that we have to be correct. Remove all the decay, have a good bonding agent, which is another field of discussion in general. And then have the composite. And it could be in less than an hour for sure, if you are simplified to do a class 2 restoration.
I see. Again, like I'm fixated on Accord and Essentia right now, is because you mentioned them. In your practice, on your workflow, which areas of the tooth would you use Accord, and which areas would you use Essentia? I think Essentia, like light, would be very good for the outermost part, maybe incisal part of the tooth.
Yeah.
On the more inside part of the tooth, would you rather use like a dark dentin shade of Essentia or an Accord, for example?
For sure, I would ask again about the case. If we take statistics,
Yeah.
and I mean at least in Greece, and I know at least in Europe
Yeah.
and Japan as well, the population is aging.
Yeah.
So we do need colors that are not so white for the general population. So in this way, you can use both materials. But if you want to simplify your life, and because we know Accord, you can use it as a one body incrementation and just put a little bit of incisal. So if you want to be more easy to go dentistry, I would go with Accord. But there are cases that you can charge more. You can even say that, okay, we have this solution and this solution. This will cost this, and it's double the hour that we're going to use. And we can have this or this, and let the patient decide.
Yes. Another product that I don't know if you use it a lot, EverX.
EverX Flow.
You use
For
EverX
sure.
Flow? Yeah.
And EverX as a paste, but
Yeah.
I would say in the courses that we do for posterior,
Yeah.
depends on the course. I mean, if it's a 1 day, we normally give one certification of composite, one layering of composite in the posterior. But if you want the simple way, as we said before,
Yeah.
I do 80% of my cases using Dentin EverX Flow as a dentin, and Universal from Essentia kit. Universal is a great composite for the posterior. The stiffness is great, and you can have occlusal morphology exactly as you want. Nowadays, you can also use injectable for posterior, but to tell you the truth, 90% of the dentists will be afraid. And it's not bad to be afraid, and it's not bad to wait for to see results from studies to decide to go in this region. You can try, but there are some clinicians that they already do it and they have really nice results. But I would say that I would wait for injectable to go to the posterior. EverX Flow though, and Universal, it's maybe for me 80 to 85% of the cases.
I see. Thank you very much for all the information you shared with us today. But one more thing is that if there is one point that you would like people to take with them from this podcast, from your lectures, or from hands-on that you give, what would be that point? Something that they have to always keep in mind.
You know, this is a really tough question, huh? Because at the end of the day, we are dentists.
Yeah.
And it's not always a point, yeah, remember to bevel, or yeah, use that, or no. We are dentists, we are human. And the point that I want always to give in my lectures is that we can be better, we can discuss. There are mistakes, everyone does mistakes, but we, as I said yesterday, it's a good idea not to say mistakes.
Yeah, right. Yeah.
It's opportunities. So I would say that we have the opportunity to get better. So this is the
don't look at whatever
message.
bad experience that you had as a mistake, just as an opportunity to get better at it.
And I'm really happy that in the courses that we do, we have a lot of discussions on that field. And it's not only learn how to make a perfect cusp or a perfect 4-class, because if you do a lot, you will get better at this. It's about getting better as a dentist, get inspired because you see other people that can do it, then seeing yourself to be able to do it.
Yeah.
And this will make your life easier and happier if you're happy at your dental life.
Yeah.
And it's a big part of your ordinary life.
Well, thank you very much for your time.
It was a pleasure.
Appreciate all the information.
It was a pleasure.
Okay, appreciate you.